My name is Dr. Ken Anderson, and I'm here at the Anderson Center for Hair with a special guest, Mr. Russell Youngblood.
Hey,
How are you doing, bud?
I'm good.
Yeah, I've known Russell a while. Tell us, how long has it been? I've been
Well,
10
we
years it feels.
met in 2014.
Yeah.
I became your ad rep when I was at David Magazine. I got assigned your account because the manager did not want to come all the way out to your place. And I'm so thankful because you became one of my best accounts all these years later.
Oh, very good.
Yeah.
Very good. Well, it's been, so I've seen you on and off, and of course, I notice these things, when patients have hair loss or just people I meet in public or someone at Kroger. Of course, I'm always thinking about that. So I noticed that, but recently you've reached out, and so Russ has decided to do something about his hair loss.
Ugh.
And we were just talking in the patient lounge. You mentioned that recently a photo was taken of you. Can you share a bit about that?
Yeah, it was the night before Thanksgiving, and I was at a club, and so we just did a little quick selfie, and I posted it on Facebook. And a couple of days later, a friend called and said, "You need to take that picture down." And I went, "Why?" And they said, "You need to take a double look at that picture, and you'll take it down." And so, well, here it is. And I did, and you can see why he said it. I just had not realized how noticeable that hair loss was. I mean, it's
Yeah.
my forehead has just gone all the way back to the back of my neck almost. And my little sister, who is a hairstylist, had told me I would not go bald, but when your hairline is going back to the back of your neck, that's called going bald. I've
True.
decided that it's time to do something.
Well, you know what? That's a great example about, I always say hair loss hurts. No
Yeah.
one enjoys it. And really what you've experienced with the loss of the frontal hairline is you've lost the frame to your face.
Yeah.
The hairline really, especially in men, is kind of because women, they tend to lose hair on top of the head, not so much the hairline typically. But with men and a receding hairline, you kind of lose the frame to your face. The hairline is a cosmetic subunit of the face itself, like the ears and the nose and the eyes and the mouth. And so when you lose that, patients can look fairly dramatically different. And that's why some of the before and after photographs of hair restoration surgery patients can look so different because you're re-adding that component of the face itself. So I think you're going to have an excellent result, and I'm glad you came to see me about it. So it's a Friday. It's just after Thanksgiving, as you may have picked up. So you're having your procedure on Monday. How do you feel about it?
Of course, I'm a little nervous, but I know I'm in great hands, so that helps a lot. I'm excited because I can't wait for this journey to begin, and I'm looking forward to it all in one.
Okay. Well, it's something I've been doing for more than 20 years. I promise you, it's something we do every day. And I think you're going to be very pleased with how smooth and painless and how much of a nothing burger it really is. I just want to make a comment though, in terms of, you're having some hair loss. It's been progressing over the past 10 years or so. Just for the audience out there, when hair loss starts, it never stops. Even if it pauses for 4 to 6 or a number of years, it will always continue. And so one of the things I tell all hair loss patients is that it's important to protect the hair you have. You've got a lot of nice hair on top of your head right now. We're going to add to that, lower the frontal hairline, add some in back, and give you a lot more hair. But really, it's going to look good in the long term if you do things to protect that hair on top of your head. And we've talked about this in consultation. The main things are a topical medication that has a number of things, including finasteride and minoxidil. A laser cap also works very well. And then PRP procedures every 4 months or so. Those three things can really, really help to dramatically slow down or appear to stop the progression of hair loss. And so it's sort of like protecting your investment, if you will, because you don't want to, and I don't want any of my patients to end up chasing future hair loss with restoration surgery when it can be prevented. It's going to be a first-class experience for you.
Well, I'm very
I'm
excited.
looking forward to it, bud.
Yes, sir.
Thanks for
Thank
coming and
you.
doing this for us.
Oh, absolutely.